I've heard a lot about this ventilator, and I was asking Professor, why are you so somebody talking about a ventilator on news? And yet I knew Makere and KIIRA Motors was making a ventilator. But now I have the answers. Allow me to say congratulations for a job well done. His Excellency the President has been talking about this ventilator because he was informed by Professor Vazeo that the scientists and the engineers are working behind the scenes to support our response to the pandemic. And we should not worry because we will have ventilators if we need them. And today, here we are. I was actually sitting and watching that dummy breathe, and I asked him, it is breathing? He said, but that is what it's supposed to be doing. So thank you very much for a job well done. As the pandemic evolves, many of you may be aware that after the lockdown, things have begun to change. And we are moving from what we call stage 2 to stage 3, where we are seeing clusters. And the clusters are now in some specific districts where you can quickly understand why. We have a hotspot in the north, Amuru, Adjumani, and Gulu, and they are all areas near a point of entry, that is Elego. Then we have another hotspot down south, where you have Chotera, Rakai, and Isingiro. And again, those are very porous borders and points of entry. Understandable. But there is also another growing hotspot in the city, and we need to be alert. And as all of you are aware, although the majority of the cases are mild, when the numbers begin to overwhelm the health system and there is health worker fatigue, that is when trouble starts. We now have about 603 patients on admission. That's a huge number, and the numbers will continue to grow. When the numbers are many, the health workers have less time to pay attention to each individual patient and attention to the comorbidities. That is when we have people rolling over to the other side of moderate to severe. And so it is timely that you unveil this ventilator and we get set, even as we are expanding the health facilities to accommodate the patients. Many of you did hear the presidential address on Heroes Day, when he mentioned that we are now prepositioning Nambole Stadium to accommodate patients. And indeed, before this week closes, we may have patients at Nambole. We thank God that these last 2 days we've got fewer numbers. Yesterday we had 8, but 8 are not few. If you get 8 every day, by the end of 30 days, you have 240. It is huge. We are also expanding the facilities at the regional referrals, which are all currently full of patients with COVID-19. And these patients don't leave hospital early. They stay on and on and on. But it is our responsibility to ensure that we don't lose people to COVID-19. It is preventable, it is manageable. And God has been faithful in that He gave us time. He gave us time. When the pandemic was moving from Asia to the United States and then down to Africa, we had time. And His Excellency the President also work towards ensuring that we have time to prepare the country through the lockdown. I must say it has been teamwork, cooperation, and determination of all the Ugandans. All the Ugandans. I take credit on their behalf, but it is not my work. All the Ugandans, as he said, everybody moved together to say we must keep our country safe. And I want to appreciate Ugandans for moving as one. When you have a public health event and then you start pulling ropes like what we saw happening in the US, everybody talking on their own, people fighting each other, you lose it. And this is what he used to tell me. You lose it if you don't move as a team, speaking one language. And I want to appreciate that in Uganda, it was not only the medical fraternity. As you have clearly been hearing, we have had engineers coming on one hand. We have other people, other civil society coming. Even during the lockdown, people were busy, giving great ideas, doing things here and there, making sure that the whole system is flowing. And because of all these efforts, we have not lost anyone up to now. Our discharges today are 119. More patients will be discharged today, maybe 80 or more. As we continue to evacuate the hospitals, others keep on coming in. But there is obviously need to plan for the 20% that progress to severe. There is need to plan. And as we prepare Mulago and the Women's Hospital, we must not forget that the majority of the patients will be out there, not here in the city. So we need to make sure that all the regional referral hospitals have such equipment ready on hand, ready for use. And the health workers also trained to use them. We cannot assume that health workers know what to do. Even now, if you took me there, although it is long since I last practiced, I will not even be understanding. I may know some of the equipment. So you don't make assumptions. People need to be trained on what to do so that we are ready to move when it is needed. I also know that there are other innovations that you have come up with, although today you have not mentioned them. But I have seen very beautiful mobile hospitals ready to be used. Innovations by Ugandans. I want to appreciate again the President for saying we should learn to be self-sufficient. The knowledge is with us. Ugandans are extremely bright. Usually what puts us down is lack of resources. But today we had all these that went into making this ventilator was available in Uganda. We didn't have to import, which is a plus, many pluses. And such innovations encourage the youth to even do more, and many others. We are proud of the vehicles. We are proud of these innovations. We are proud that there is development going on. At our own pace, we shall get there. The middle-income country that we so much desire will come to pass. Professor and the rest of you, today we will be listening to the budget speech for the next financial year. And what a great joy to unveil the ventilator the morning of the budget speech. There will be parts of the budget speech that will be speaking about COVID-19 and how we are going to handle it moving forward. And for me, when I'm sitting there, I'll just be knowing that my head can go to rest on the issue of ventilators. There are people who are thinking about it and working on it. Again, allow me to appreciate the scientists who have done this, and to appreciate you, Professor, and to appreciate the one who brought the wonderful idea that let's do the ventilator. We are grateful, very grateful. And lastly, let me appreciate you for keeping safe. We are seeing a trend where people are becoming very complacent and thinking now everything is okay. It seems people assume that the lockdown ended the virus. Now as we begin to open the lockdown, everything is okay. When I look downtown, I feel very sad because I know if anything goes wrong there, that is when trouble will start. That is when trouble will start. So please remind one another that the virus is still with us. The virus is still, the pandemic is still evolving. The direction in which it goes will be determined by ourselves. If we adhere to the preventive measures, it will be well with us. If we are careless and we don't follow, we shall also pay the consequences of our carelessness. May the good Lord help us to keep safe.
This ventilator is less than $4,000. And when we make more, the more we make, and when we get more materials, the ventilator will come so low. And we have the human capacity to do them and have enough for Uganda and maybe for the whole region. We also, he will tell us the other groups that are there, the people in Mlago, those in theater, those anesthetists that you always see. You don't see because when you go there to be operated, they just make you sleep. Then by the time you see them, you're already out in your bed. So we brought everybody together. We've had several meetings. And then the resources that we needed, we knew that if we came to you, you have these other business things that you are looking for money. The Minister of Science, Technology and Innovation, this is Dr. Sembatia, please sit here. He's the guy who brought the idea from his former university. Ladies, whenever in Wanyankore they say, wherever you travel, make friends. And he did exactly that. You're welcome. Have a seat. So, when we brought them together and had meetings, we said we needed some money. We needed some things. And then we have this grant that Cabinet gave to Makerere University for research, which we call the Research Innovation Fund. And we said, since our professors and lecturers are locked down, the money they were supposed to use in research at that time was available. So we said, let's swing it to the emergency. Then when they come back, we shall see how do we raise those monies they need to continue with their research. So the resources that have done this, and he will tell us how many they have done and how many we can do, are Uganda government resources for research in Makerere. We have not got any donor money into this. And we believe that at this cost, Uganda government can fund and have enough ventilators. So,
value chain. The principles that have been utilized in making this one can be extended to making nebulizers, dialysis machines, oxygen concentrators, so a variety of medical equipment. This is just the beginning. So, and then beyond that, the lab system in the country can be made mobile with like hard to reach places. So combination of what the KIIRA Motor Corporation has been doing on the buses, KIIRA buses, we are thinking of creating mobile facilities that can be moved around the country, especially in times of crisis.
If you didn't hear well, from this, you know, the other machine that is very expensive for Ugandans is the dialysis machine. It can be made in the same way, and the team is on the way to do that as well. Thank you, Honorable Minister. If you take your seat, and then the media can